Uh, Welcome to my PowerPoint presentation on the human skeleton system. I hope you learned some valuable information and enjoy. Uh, the human skeleton system is a complex uh, division made up of bones, joints, cartilages, and ligaments. And the skeleton is divided into two divisions. Number one being the axial skeleton, which include the bones in the skull, the hyoid bone, the thorax, and the spine. And then the appendicular section include the bones in the upper and lower extremities. Um, the functions of a bone, number one, um, as you can see, support the body. Uh, it allows us to, again, it protects our organs. Um, and then the movement, it allows our body to move like it should, back and forth, side to side, able to walk, sit down, twist, turn, exercise. We have to have, obviously, the bones to keep us moving. It stores our minerals in our body, especially calcium. Bones are made up of primarily calcium. Then at the end, last but not least, hemopoiesis, or the manufacturing of blood cells, or for lack of better terms, just blood cell production, is all that amounts to, just making blood cells. The normal human body has 206 bones, and the periosteum is the tough outer membrane on the bone. So that's the outside of the bone. That is the rough edges, or the rough texture on the outside. The interior part of the bone is more spongy, and that's where the cells and the marrow are contained. Bones contain circular rings of tissue called the Haversian system. It's a very complex system of cells containing and making up the bone marrow, the red and the yellow. The axial skeleton contains 80 total bones. The upper extremity section of the appendicular section includes 64 total bones, and then the appendicular lower extremity section has 62 bones total. And by that being said, the total appendicular section has 126 bones if you combine the upper and lower extremities. Again, with that being said, the appendicular total and the axial total makes the normal 206 bones in the human body. There are a couple types of bone cells. The osteocytes, which are functional cells in the bone. So therefore, a mature grown adult, his bones have osteocytes in there because we are fully grown, our bones are fully made, and are hardened by calcium. And again, osteoblasts are bone-forming cells. They, pretty self-explanatory, help form bone. A prime example would be, as a baby is an embryo, its primary cartilage, it is primarily made up of cartilage until the baby is born. Once the baby is born, the process of ossification begins, which is, as you can see, just the process of bone formation. Until we become a mature adult, we're mainly bone, other than a few places, which would be the nose, the ears, the voice box, and the points at where bones attach are cartilage. The human skeleton, again, is primarily bone other than the nose, the outer ear, the voice box, and the points where the bones attach, which make up, that's just the area where cartilage is at. The axial skeleton supports the bones in the skull. That would be the cranium and the facial bones. The hyoid bone helps hold the tongue and the muscles in the face, as well as the thorax. It includes your ribs and the sternum bone, and then the spine, which are your vertebrae and disc in the back, making up where the body will stand straight up and allow us to move side to side and walk. As you can see, you have this is the axial skeleton, the skull, the spinal column, the pelvic bone, and then, well, all the way down to the sacrum and the coccyx, not the pelvic, I apologize, and then the rib cage. You have the upper 7 connected to the sternum, which are called true ribs, and then the rest, the other 5, are called false ribs. Ribs number 11 and number 12 are called floating ribs because they don't connect to anything. With that being said, moving to the appendicular skeleton. The appendicular has bones in the lower and upper extremities. The two subsections again are the upper extremities and the lower extremities. Your upper extremities include the pectoral girdle and the upper limbs. That would be your wrists, hands, fingers, arms. The lower extremities would be the pelvic girdle and down, which would be your lower limbs, legs, feet, toes, ankles, knees, all those kind of things would be your lower extremities. Again, arms, fingers, wrists, hands, collarbone, shoulder blades, and the bones of the lower extremities total make up the full appendicular skeleton. As you can see here, the arms, forearms, the hands, the fingers, the shoulder blades, then the pelvic bone, or the hips, and then the femurs, the knees, the shins, and all the way down to the feet make up the appendicular section. The appendicular is the biggest part of the body. The axial skeleton only includes the skull, spinal column, and then the rib cage. There are 2 types of bones in the body. The sutural bone, which are small pieces found between the cranial bones, which is in the head, or in the skull, if you will. The points at which the cranial bones meet are called the sutures. Kind of brings to remembrance when we're embalming, when you make the incision and you're finishing up, and you close the incision by suturing it shut, making small incisions. It also brings to mind the small points at which the bones meet. Small incisions close up, or small stitches close up the incision. Moving on to number 2, the sesamoid bone is a small bone that resembles the sesame seed, hence the name sesamoid, which is where the name came from, because those bones are small and they're occasionally found in tendons. A prime example of the sesamoid bone would be the kneecap. The skull contains 3 parts, the cranium, the face, and the ear bones. There are 8 total bones in the cranium, 14 total bones in the face, and 6 total bones in the ears. The cranium encases the brain, surrounds the brain, if you will. That's the top part of the skull. With that being said, there are 14 bones, again, in the face. There's, just to name a few, the nasal septum, the nasal bone, the temporal bone, sphenoid bone, the maxilla, the lacrimal bone, zygomatic bone, which make up the cheeks. There's multiple bones in the face that keeps the face together. The second subdivision of the skull, again, is the face, containing the nasal bones, which are the 2 small bones that make up the bridge of the nose, the lacrimal bones, which are the bones located and make up your eye sockets, the vomer bone, located in the midline of the nasal cavity, the zygomatic bone make up the cheekbones on both sides, the palatine bone forms the part of the roof of the mouth, the maxillary bones form your upper jaws, the alveolar is where your teeth are embedded in the bottom. The mandible is the lower jawbone, and then the mental eminence is the tip of the chin. The mandibular condyle fits into a depression on the mandibular fossa, and then the inferior nasal concha is a ridge located on the wall of the nasal cavity. The ear bones, 3 tiny pairs of bones are called auditory ossicles. Number 1 being the malleus, which is the hammer-shaped bone, the incus, which is the anvil-shaped bone, and then the stapes, which is the stirrup-shaped bone. And then as you can see in the diagram, the malleus here is the hammer shape. It looks like the tip of a hammer, which is connected to the incus, and then at the tip of the incus is the stapes, which is on the very tip. And those make up the auditory ossicles, or, for lack of better terms, the ear bones. The hyoid bone is the only bone in the body that doesn't connect to any other bone. It is surrounded by tissue and muscle and cartilage, but it doesn't connect to any other bone, and it's the only bone in the body that does not connect, period. The hyoid is just a few inches above the trachea, and is, like I said, is very easy to remember because it's the only bone that doesn't connect to anything else. Moving along to the vertebrae and the spine, you have 26 vertebrae that make up the spine, and they're stacked, if you will, on top of each other with cartilage in between. And then those 26 vertebrae are divided into 3 groups: the cervical section, the thoracic section, and the lumbar section. With that being said, you have 7 vertebrae in the cervical section. Then the atlas is C1, and axis is C2. With that being said, those 2 vertebrae connect together, allowing the head to move side to side as it should. The thoracic section are the 12 vertebrae in the upper back, and that's labeled number T1 through T12. Number 3, the lumbar section, is the 5 in the lower back, which make up L1 through L5, and that is in the lower back. And then it goes all the way down to the sacrum and then the coccyx, where there's vertebrae there, and then the coccyx is the tailbone. Again, there's 7 sets of ribs that connect to the sternum, and those are called the true ribs. And then the 5 bottom pair do not connect to the sternum, and those are called false ribs. And then, as I mentioned previously, ribs number 11 and number 12 are called floating ribs. As you can see, again in the diagram, the first 7 are the cervical. The next section is thoracic. The last 5 are the lumbar, and then you got the sacrum here, and then the coccyx, which makes up the tailbone. The sacrum is 5 fused vertebrae, and then the coccyx is 4 fused vertebrae. Joints in the skeleton, you have 3 different types. You have synarthrosis, which are immovable. They do not move. There's no movement in that joint, and that would be an example. That would be the cranial sutures. They don't move. They're stuck, if you will. The amphithrous are slightly movable. An example of that would be the pubic symphysis. And then at the end, which is the most known, would be the diarthrosis, which are freely movable articulations or connections, which allow movement. Hip, knee, elbow, shoulder, any joint that allows movement would be categorized in the diarthrosis section. Again, that would be the hip, knee, elbow, shoulder, anything that moves. Again, a lot of times normally there's cartilage in between each joint, especially the kneecap, and then when that cartilage wears away, the bones rub together, and that's what requires a knee replacement. So, again, cartilage is in the nose, the outer ear, and then at the points where bones connect, or joints. So we have cartilage in our hips, elbows, shoulders. There's cartilage all throughout the body, just where the bones connect. I think that brings us to the end of my PowerPoint. I hope you learned something that you can remember and that will be helpful. And I thank you for watching.